Hi, I'm Dr. Tonya. I'm a board certified radiation oncologist and breast cancer survivor. I'm committed to helping you get the hope, information, and inspiration you need to make your next season your best season after cancer. Today, we're reviewing products that you can use on your skin during radiation. And today's products are going to focus on on products that you can use once the skin gets irritated. Once you develop what we call a radiation dermatitis, that's when you get redness, itching, stinging, and some burning of the skin or peeling of the skin. So you want to use a different type of cream than one that you started with when your skin becomes irritated, because now you need symptom relief. You're not trying to prevent symptoms. So today's cream that we're going to be reviewing is called Camwell Herb to Soothe Cream. Now, this is something that I found online. I actually have never heard of this cream before, but I'm always wanting to learn new things, and I definitely wanted to review this for you. So this is Camwell Herb to Soothe. It is an all-natural herbal formula, and I'm going to read this to you because it has a lot of unusual ingredients that I've never heard of. It's a proprietary blend of rhubarb root, cactus, dictamnus root bark, amber cork tree bark, light yellow sephora root, and giant knotweed rhizome. It does not have any artificial colors, fragrances, or dyes. Let me see what it looks like. Comes in a very, very tiny tube. The directions say to use this twice a day. It says to use just a pea size. And can't really smell it. I don't smell it. It doesn't really have a fragrance, but it says use a pea size. Let me open this because it may be sealed, and it is very good. It should be. We're going to open this. Aha. Now we can get some out. So it says use just a pea size. Oops, that's too much. That's what it looks like. It's kind of a yellow mustard color cream. It doesn't really have a fragrance at all. I don't smell anything really. And the directions say to just spread it on the skin and let it absorb on its own. It says you don't need to rub it in, which is unusual. So that's what I'm going to do. I'm just going to spread it on my skin. And I'm going to let it absorb. Spread it out. I guess you kind of have to get it all in, but typically, any skin cream that you use, once you get a radiation dermatitis, you're going to use it twice a day at least for that symptomatic relief. You want to use it every day, 7 days a week, even on the days you're not getting radiation. You want to continue it even after the radiation is over, because the radiation reaction will continue because you're still getting radiation effects after the treatment is over. Kind of feels cool and refreshing, kind of soothing on the skin. It's not oily at all. It's not sticky. Actually, it feels pretty good. I honestly, even though it says you only need a tiny little dab, that little dab really only covers a very small area, so I don't know that this little tube is going to be enough to get you through an acute episode of dermatitis, especially if it's a larger area like a breast or a chest wall. You may need more than one tube, but it does feel good. I personally can't say that I've tried it in my practice or on a patient, so I can't tell you, how it really affects the symptoms that you're having during that period. But I mean, it does feel cool and refreshing going on the skin. Again, this can be found online. There will be a link below in the description to connect you if you want to try out Camwell Herb to Soothe Cream. I'm Dr. Tonya. If you liked this video and you want to see more videos like this, subscribe to my channel. I send a new one out every week. You can also follow me on social media at drtonyamd.com. That's DrTonyamd.com.